About 120,000 Michiganders born in 2000 will be celebrating their 26th birthday this year. That means thousands are stepping out from their parents' health coverage for the first time. Emily Martin's lead territory manager at Priority Health is here to talk about how to start the search for coverage. Thank you for being here with us. So let's just talk more about those who are turning 26 this year. A big milestone, a lot going on, a lot to think about.
Yeah, a lot to think about. Remember way back when I started at Priority Health, actually, that law kind of came into play, and those numbers got extended, so people got to stay on their parents' coverage longer. But it is something to talk about. It's a transition period. It's, like you said, for the first time, they're going to be looking for health care coverage in a lot of cases. Maybe similar to making their first medical decision, like when they figured out who their doctor was going to be, or filing taxes, things like that. But yeah, it's something that should be on their radar if they're not on their own employer's plan, and would love to help talk through options.
So where should they even start? Walk us through all of this, how to begin.
You bet. So I think it's important to kind of get a grasp on what they need from a medical perspective. There are a lot of resources out there. We at Priority Health have an internal sales team that can actually talk with those folks if they want to go over some marketplace or off-marketplace options where they don't have coverage through an employer. There are solutions possibly through Medicaid, depending on income levels and things like that. But like I said, we have an internal team. There's also the marketplace. They can go out to the marketplace themselves or use a platform like Health Sherpa. They can call one of the independent agents around Michigan, and they can also walk them through those options. So there's resources out there. I'd say don't try to just do it on your own when there's help, and it's free to use either our internal team or an independent agent and Health Sherpa. All those options are free, so utilize those where you can.
For sure. And health insurance can have some, confusing terms, right? Share some of the lingo that buyers should know about, right?
Yeah, it's, I'll start off with premium. So that's a monthly amount that you pay for coverage. Usually whether you have coverage through your employer or not, you'll probably have some sort of a premium that you pay to a health plan monthly. Not something fun probably that they want to do, but it is a key part of it. But those amounts can adjust to based on if they qualify for a tax credit. I want to put that in there. A deductible, that's an amount that you would pay before services kick in, say if you went in the hospital or had an emergency room visit. There's a co-insurance, that's a percentage that you would pay after your deductible's met. And really, well, a copay too, that's a flat dollar amount. So if you go to your primary care physician, many plans will have a flat dollar, maybe say $30 that you would pay when you go to the doctor. And then you've got the all in all, the out-of-pocket maximum. So that's the most that someone would pay in a year for services if something really crazy happened or they were hospitalized. So that's probably the biggest number that you want to look at and see what your risk essentially would be for that year.
What are some common mistakes that you notice with first-time health plan shoppers, and how can they avoid them?
Yeah, so network is a big thing that you'd want to look at. And a lot of times when we're talking about 26-year-olds, that's an age where they're probably still generally pretty healthy. But if they are seeing a specialist or a primary care physician, they want to make sure that the network that's on the plan that they choose actually accepts those doctors so that they'll pay them. And another thing would be looking to see if the plan covers the medications you're on, if you are on any of those. So cost is a big deal, is a big issue, especially at that age. I have a kid that's 22, and so she's kind of in that realm, figuring out her budget. But you don't want to just choose a plan on cost. You want to make sure that it covers the things that you need covered.
Okay, Emily, any other tips for staying healthy while adulting, right?
Yeah, sure. Making sure that you have coverage is really important. It's easy to think it's not necessary. We have a lot of resources at priorityhealth.com. There's some great articles at priorityhealth.com/thinkhealth, so would love folks to check those out, connect with our internal sales team or one of the independent agents in West Michigan for any of those resources.
Yeah, a lot of help and resources out there, free resources too as well, right? All right, Emily Martins with Priority Health, thank you so much, very helpful.
Thanks for having me.
All right, Sarah?